COVID is awful. It's awful. This is not something that you want. Everyone that I see with it in the ER will tell you, I didn't know it was going to be this bad. I didn't know that this was going to happen to me. If I send them home, they're considered a mild case, and they don't feel mild. They feel like they're going to die.
The scary part is the people not being able to breathe. If you just hold your own breath for a little while, it's a scary feeling. And to know that they're dealing with that 24/7 when they're going through this.
Our healthcare resources are very stretched right now. It's not a matter of whether we had a bed available in the hospital, it's whether we have an appropriate bed with ventilation for patients with COVID, as well as whether we have staffing.
Our hospitals, which already run to about capacity normally this time of year, are now being overstretched. If you're sick and you're getting sicker, we have a very hard time finding an ICU level bed in a surrounding bigger community. That's very scary to us.
As an emergency room nurse, I would like the community to just acknowledge the fact that a mask will save your best friend's life, your mother's life. It's not just about you and protecting yourself, it's about protecting others. And the more that's not done, the harder it is for me to do my role in caring for everybody else here at MMC.
And if we don't have staff to run the emergency department, then we don't have an emergency department.
What frightens me and concerns me most about this disease, COVID-19, is that it isn't selective to individuals that have the risk factors. It can hit anyone, young, old. It can hit them hard. It can really wear them down and turn into pneumonia rapidly. It's the unknown.
They're alone. I've had some people that all they had was the nurse. I spend a lot of time with them because we're their family. Why their family can't be there?
A number of my patients have become either very, very ill or they've died.
We have had people in our community die of COVID, and I have been there for that, and it's awful.
I had a friend in here that he was doing really well here, we thought. He was sent up to Duluth. I heard that he was out of the ICU, and a few days after that, I heard that he had passed.
People can be breathing and be fine and look okay, and then 7 hours later, they're dead.
For me, it's personal. I have to take into account that I'm going home to my wife and my two small boys of 1 and 2 years old, and I have the potential of spreading COVID. And so oftentimes it doesn't become real until there's that personal connection.
I cry all the way home. The 45-minute drive home, I cry the whole way because it's so awful.
The 20 years of experience, this is nothing that I've ever experienced in my whole career. Nothing that impacted our everyday life like it is right now.
The biggest thing you can do to protect your community, your loved ones, is to wear a mask.
Everybody wear their mask.
Wear your mask.
Wearing your mask.
Wear a mask.
We need you to wear a mask.
If our community came together, we all worked as a team, and we all did what we were supposed to do, we are going to see a decrease in the amount of COVID cases. Really, all we need to do is make it through this.